So good afternoon. This presentation will be not about cats. However, I can do some reasoning. Cats are owned by radiologists. And this will be about radiologists, but not only about human radiologists, but about maybe something which we can call AI radiologists. But we observe many predictions about AI in the media. For example, as you know, Elon Musk predicted the area of autonomous cars for 2016, 2018, etc. There is even a website on Wikipedia about those predictions. Then, in 2016, Professor Geoff Hinton, one of the fathers of modern AI, but also a Nobel Prize winner in physics, actually in AI, but in physics, he said, probably people should stop training radiologists now. And according to his prediction, it should happen within 5–10 years. But today, 2025, radiologists commute to their traditional work in their own, sometimes better and better, cars. So even projected radiologist supply is increasing. And still, we need much more radiologists because of the scientific and technological progress. So there is also another issue related with radiology. It means that more and more people are subspecialized in some narrow area in radiology, for example, head MRI and so on. And in this talk, I argue that AI agents, from the technical point of view, can be effective radiology subspecialists in addition to human radiologists. So historically, radiologists performed examination and were very close to patients. But because of technological progress, they were moved to some dedicated rooms to download studies from servers, to analyze those studies and provide some interpretations. Of course, not all of them, but a lot of them. But why not to move those radiologists from those dark rooms to homes? And as you know, teleradiology is very popular, and a lot of radiologists are providing different, let's say, image interpretations from their homes. So it means that, well, from the historical encounter of doctor and patient, we see that there is something what was changed. Patients are far away from doctors, and sometimes radiologist has never been seen by a patient, sometimes even not by a clinician. So we can say that such kind of radiologist is something like, well, radiologist as a service, we would say. So it is something like human cloud computing. Well, in traditional image analysis, a human radiologist receives machine-generated images, and they are, of course, using expert knowledge, great expert knowledge, are analyzing those images from different perspectives. But sometimes they are also using some tools, for example, to annotate images, to measure some features, to get some radiomics, to generate some feature vectors, even to use traditional machine learning. However, as you see in this pipeline, there are separate phases. However, in the modern deep learning models, we have opportunity to detect the most important features for the most specified task, like, for example, classification, segmentation, and so on. So the entire process is more autonomic. And, well, based on the research in the previous years, we see that there are different AI tasks, in radiology, for example, image reconstruction or image quality improvement, for example, super resolution, then image classification, when we can assign a label to an image or a part of the image segmentation, when we can get a segment just indicated with the location and detail borders and so on, etc., etc. So there are many, many tasks related to application of AI in radiology. What is even very important, a lot of new research works are published not only in engineering journals, but in medical journals, like, for example, here, European Journal of Radiology. And what you can see, this is even the future, because the dates of publishing are November this year or December this year. And all of them have titles like AI something, ChatGPT something, and so on. From research, we can go to development phase, and today we can find a lot of systems where you can perform experiments with some prototypes of AI models or tools. So you can easily download them or execute them. You can provide your own solutions, so you can do a lot of experiments with such kind of tools. But of course, before we can introduce them for the clinical practice, for example, we need certificates. And for example, the FDA has authorized more than 1,000 medical devices. Software is also a medical device that incorporate artificial intelligence and machine learning. And what is even interesting, the FDA is using AI for the scientific review process of the applications. If we have the certificated products, well, we can share with other people. So there are, for example, special AI marketplaces where you can find certified products for different purposes. You can buy them, you can get them, you can do some experiments, and so on. And then, for example, the results of such a certificate AI tool can be a dedicated report showing results for a particular specific medical problem with detailed annotations and so on. However, we also would like to create tools that will be integrated with the typical software that is used in clinics. So, for example, the clinicians or radiologists can use typical tool and send this study to some kind of PACS server, and then after a few minutes, she or he can download the annotations with the results of the, let's say, image interpretation. So it means that it could be automatic and without additional tools. It can be embedded in the natural, let's say, software which is used in the radiology department, for example. And we are doing a research in this area. And such operation is transparent, for example. It means that when a radiologist sends the image somewhere, then this proxy server can decide, for example, also using AI tools, to which provider send the data for analysis, and then after minutes to obtain the results. This is very important. Okay, so we know now that there are some AI models that are very accurate, that have certificates. And the question is, would you agree to be diagnosed by the certified AI agent with high reported accuracy? Could you please raise your hand if you agree to be diagnosed by AI agent? Please be brave. A lot of them, nice, but you are biased. We are on the AI conference. So, well, that is why there is a lot of different surveys. For example, one of the survey of more than 1,000 people, 64% of respondents said they would trust a diagnosis made by AI over a diagnosis made by a doctor. But what you can see about, let's say, the responses regarding the generations of responders, you see, more than 80% of people born in or after 1997, like my children, for example, they agree with this thesis. And we are talking about the future. So, will we really observe the rise of robot radiologists? Well, many advantages speak for themselves. For example, a new AI radiology subspecialist can be distributed worldwide in seconds, everywhere. The only requirement is fast computer networks. And then we can have not only a second radiologist's opinion, but also tens of other AI radiologists' opinions. We can use majority voting and so on, whatever. The AI radiologists can be easily updated worldwide. If there is a new knowledge, how to train 100,000 radiologists, for example, immediately. This is very difficult. And you can do such kind of update for AI radiologists. By the way, there is a conference like RSNA conference in the United States of radiologists where there's something like 40,000 people. So please observe in media when this conference is, and please be not ill during that time, because there will be not radiology at your hospital, for example. What is even more, accuracies and mistakes of AI radiologists can be reliably tracked, because we can measure those mistakes, we can get some different metrics, etc., and we can also try to teach, to train those models using those results. So, according to medical doctors, the role of the radiologist is evolving from the traditional image interpreter to an information specialist. And this is a fundamental transformation because it is driven by diagnostic data's increasing complexity and volume, but also by progress in medical imaging devices and also AI tools and so on. So, there are some studies also that are showing that the chatbot responses, so we can say AI agents, were preferred over physician responses and rated significantly higher, not only regarding the quality, but also empathy. And now it's very important to underline that for AI agents, we have quality metrics, like, for example, precision, sensitivity, accuracy, F1 score. You know maybe much more such kind of different measures. Do we have such measures for medical doctors or radiologists? So, for example, you are waiting in the waiting room and okay, this doctor has specificities 0.9, this for 0.72, okay? Well, this is not numerical, but you know different doctors, so sometimes you are discussing, okay, maybe we will go to this doctor, not to that one. There are many different studies that are presenting something very political, that AI, together with human medical doctors, together are producing something better than either AI or a human radiologist. However, there are also studies that shows, like this one, that you see AI model is much better even if we compare to the results obtained together by clinician that is assisted by AI. Why? Well, this is very important point, which we are not discussing today. The bias of radiologists, bias of human, like we are. And now a very short experiment. As you know, radiology is about, not only of course, but also about imaging and image interpretation. So we have to analyze what we see and we have to provide some reasoning, etc., etc. So very simple experiment. We can see 4 pictures that were generated maybe by AI, or maybe there are natural photographies of people. And now there is some kind of survey. What do you think? Who thinks that this image was generated by AI? Wow, a lot of you. Who thinks that this one was generated by AI? Only a few of them. Who thinks that this was generated by AI? Wow, majority, vast majority of people. And who thinks that this was generated by AI? So, what is the conclusion? So, well, this maybe is not a very official and specific proof that you are biased. But, well, we are somehow biased. And why we are talking about that? Because, well, in radiology, we are analyzing images, and those images are obtained usually using computers. So typically, as you know, for example, in tomography studies, we have, for example, X-ray and the detector, and there is a ray, and you are measuring attenuation on the ray, let's say. And then you can do different such kind of measurements, which we call projections. And from those projections, we can calculate images. So we are actually doing some kind of calculations to get those images. So, well, if we divide a person into 9 voxels, not very sophisticated image, right? 9 pixels, but we can do that. And then we can measure those different projections. So then all we need to do is to solve the problem of 9 equations with 9 unknowns, and we can have calculated image. Well, actually, we are not using images 3 by 3, but rather, I don't know, 512 by 512. So it's much more equations. It's difficult to solve. So sometimes you are using different procedures, like, for example, filtered back projections, when there are some formulas, mathematical formulas, you see, this looks like a scientific lecture. So we are talking about different reconstruction methods, so different methods how we can get images from original measurement data. This is very important. Why? Because then, using those different reconstruction reconstruction algorithms, we can get different images. And actually, medical doctors and radiologists, human radiologists, are getting those images to perform some image interpretation, right? But also, you can see this is, for example, for filter back projection, some iterative reconstruction algorithms, and also deep learning reconstruction, which is also used to reconstruct images from data to provide those images to human radiologists. Well, but what about AI? Do AI needs images to see something? Or we can use only data, like raw data, raw measurement data. So during last years, we are very interested in finding models that will analyze original raw data and then to get some kind of results. Because you must understand that when we are doing reconstruction, we are introducing some filtration, interpolation, etc., different combinations of operations. So what you can see here are those projections, only visualized, because of course there are numbers, data, but those are only visualization of those projection data. And then based on those raw projection data, you remember, projection data measurements, we can try to analyze those data. Of course, it's difficult, but well, we are talking about possibilities in the future also. And some reports show that they found that the raw data achieved almost comparable performance with CT, indicated that we can diagnose diseases without reconstructed images. Of course, this is the new phase of research. However, this is very important. Okay, but we can also generate images with AI, for example, for medical students, to teach them about real cases and so on. But we can also, as you can find here in our research, we can do some kind of in-painting to erase some parts of the image and then to train model to fill those gaps with, for example, some data. So, for example, we can train the model on healthy cases, and then we can erase, for example, tumor or something to get some maybe healthy tissue inside. And then we can use such kind of generated image as the input to test other classifiers. As you remember from the previous lectures, it was about importance of background, that some algorithms were well trained and performed decisions based on background, not on the useful information. So we can use generated AI also to produce data that can be used to test other AI models. So it's some kind of game. What is another advantage of AI agents? That they can cooperate. For example, they can cooperate in the federated system. So each agent can work in different hospital using specific data, for example, for one scanner, from another scanner, etc. And then together they can cooperate to get the best model with higher generalization properties than a single model that could be trained on some selected subset of data. Well, of course, there are not only images in radiology or in healthcare in general. There are, as you know, different AI tools. And the future, I'm sure, will be related to multimodal models, which now are becoming more and more popular. So we will use, of course, not only images to predict something, but also combine information about patient. So, well, the AI radiologist, will it be a new healthcare profession? Well, traditionally no, because it is a profession performed by humans, if we are analyzing traditional definition. However, if we can use another definition that healthcare professional or worker is a provider of healthcare treatment, well then maybe we will have the AI radiologist, so a certified healthcare, well-trained provider agent. Okay, but well, is it possible? Will people accept that? Why not? Let's look at some history. There are some kind of devices which are called implantable cardioverter defibrillators, which are used to autonomously analyze internal ECG signals, and based on those analysis, algorithms provide treatment to heart by generating some kind of impulses. So they are autonomous in terms of diagnosis and treatment together, and they are working, I don't know, 45 years. And you can see when I was young, I do my Master of Science thesis regarding those AI, regarding those signal analysis. Well, so finally, I can also ask AI, what AI thinks about the possibility of AI specialists in the future. So about Gemini, well, the answer is yes. AI radiology agents are expected to perform automatic diagnostics in the future, but they won't fully replace radiologists. I would agree with that. ChatGPT, of course, providing some kind of predictions, 5 years, 15 years, and so on, but finally some dates, of course, it will replace. The recent model from China, Ernie 4.5 Turbo, say yes, AI radiology agents are poised to perform automatic diagnostics in future healthcare practice with their capabilities evolving from auxiliary tools to autonomous decision makers. Okay, so how we can conclude? Let's imagine a very simple situation that we can build in some kind of shopping mall, some kind of kiosk or let's say stand, when we can provide some simple, specialized imaging service without any person. So a patient can go to such kind of a room And then the voice assistant will say, hello, patient, how are you? Could you please undress? Fine, very good. Now, please put your chest close to the imaging device. Much more. Now fine. Okay, is it possible? Yes. And then, of course, the device can perform the measurement. This is possible. Then, as a result, we will have data or image, if you prefer. This will be analyzed by AI agent. Very simple. So then, even before the patient will dress, she or he will receive the result of the procedure. And this is the end of the story. Of course, there are many ethical problems with that, many law-related problems, but technically, everything is possible today, not in the future. Thank you very much.